Welcome to Health and Human Services. I'm filling in for the chair. He should be here shortly. And I'm going to ask Senator Hatchett to open us up with a devotion. What, Mike? 5?
Number 5.
Okay.
Let us pray. Dear Heavenly Father, thank you for today. Thank you for the blessings that you've given us. Thank you for all the people here that are gathered. Please be with us as we make decisions for the people of the state of Georgia, and please guide us with your wisdom. In Jesus' name I pray. Amen.
Thank you very much. Okay, we've got 3 bills on our agenda, and hopefully we'll be able to expeditiously move because there are multiple committee meetings this evening. And we'll first do House Bill 1037. Representative Daniel, you want to come on up and have a seat or podium, whatever you prefer.
Thank
Okay,
you.
floor is yours.
Thank you, committee. I will make this short and sweet.
Can you give us the LC number that you're working from?
Yes. Let's see. Should be LC 520516S.
That's what we've got.
Okay,
Thank you.
perfect. So what it does is it creates a maternal and infant health commission in the state of Georgia. There are appointments. I'll just outline them. There's 14 members on the commission currently. 6 of them will be appointed by the governor. Among them should be an obstetrician, either a pediatrician or neonatologist, a nurse midwife, either a family practice or general practice physician, and a representative of a perinatal facility. 3 members will be appointed by the lieutenant governor, and 3 members would be appointed by the Speaker of the House. And then the Research Alliance designee and somebody from DPH, whoever they designate, would also sit on this committee, or not committee, this commission. And basically what the purpose of this is we have a maternal mortality review committee. I want to make it clear that this does not compete with that. It is not a replacement for that. This would be, I always describe it as like there's 2 tables in a room, and this is a separate table, but it really, the goal here is to get legislators to the table, because currently we are not at the table. And I want, from a policymaker perspective, us to be able to hear from the women of Georgia what they're experiencing. There are some differences. Currently, the MMR looks at women who have already died. This would seek to look at women who had near misses, and this also includes infants, which is something that MMR does not include. There has been some concern about whether or not we're growing government. This has some of the governor's language in here as well, too, at the bottom, to repeal 2 existing commissions that are kind of defunct, if you will, that they don't currently operate, but to get them off the books. This does also have a sunset clause in it of 2 years, and so hopefully this will be efficient and helpful, and then it will be able to be dissolved. And I will take any questions if you have them.
I have one question. Have you had the opportunity to meet with Public Health on this?
Yes, and so they have leaned favorable and indifferent, kind of, to my understanding. They have not voiced any concern. Their only initial concern was that it would compete with the MMR, and I think after discussions, to my understanding, they recognize it won't.
Okay, any questions from the committee? Senator Lucas?
If we pass this, those members would get the regular reimbursement rate that members of the General Assembly get.
I believe that's how it is. It was set up in the same fashion that a normal commission is set up in.
Other questions from the committee? Yes. Senator Orrock?
Oh, well, I had 2 questions, Madam Chair. Thank you for bringing the bill. How do we reconcile that there's already an entity that's charged with oversight on these issues?
Yeah, so like I said, there are some very specific differences in the 2. So they really, the best way to describe it is they are a little bit hamstrung by confidentiality. They are dealing with actual medical records of women that have died, and they're taking the way it operates without going down too much in detail. Basically, once a woman dies, they take the death certificate, why they died, and they talk to the family members of things that they believe could have affected those deaths. They also count up to a year afterwards. And so what this aims to do really is to put policymakers at the table to, discuss kind of around the state, because that's often commissions will travel to different areas to hear out women who have survived, because currently those stories aren't being told, but we do have a lot of women that have near misses. And one of the biggest issues we have with infants is prematurity and low birth weight. And so trying to figure out, how the two are connected and, come up with.
Well, to your second point of involving legislators, would you be open to specifying that there should be a legislator member from the minority party?
I would be open to it. I haven't, that hadn't been brought up, but that's not something that I would be opposed to. I'm not, that wouldn't be unfriendly to me.
All right, Democrats and Republicans and independents all start families, have babies.
That's right.
Senator Rock, I don't think this got quite that specific, and the bill didn't quite get
Yeah.
that specific. It just said legislators,
I know, that's what-
legislators, so it didn't really
at
go
least,
that far, so.
we could do it by, at line 30, add a clause including one member of the minority party. It says 2 of the 3 members shall be legislators. Comma, and one member. It wouldn't be and, it would be including.
We've got ledge counsel here if
Oh,
you
good.
need some help with that.
I think the appropriate place is 29, that,
29 and 31.
that's right.
31, well, yeah, 29,
At line 30 again,
yeah.
and at line 32.
That's right. Uh-huh.
Okay, while y'all are talking about that, are there any other questions? Because we do have one person signed up to
Thank you.
testify. Okay, so I don't see any other questions, so I'm going to ask Miriam Goodfriend. Come on up to the podium, please. Go right ahead.
Thank you, Madam Chair, and honorable members of the committee. I just want to be very brief. My name is Miriam Goodfriend. I'm the policy manager at Healthy Mothers, Healthy Babies Coalition of Georgia. We are very grateful to Representative Daniel for all of her work on this, all of the conversation we were able to be a part of, and fully support and hope to continue the conversation as it goes further this session. Thank you so much for your time and attention to this issue.
Thank you for that. We don't have anyone else signed up to testify, so what's the will of the committee?
I move we pass it as amended
Well,
by the committee.
Well, we don't have an amendment yet. We just need a do pass
Well, we're gonna
motion.
write it in, you put it in, when you know
Motion
opposition
do
to it.
pass, and then we can amend it.
Yeah,
Uh-huh.
Okay.
And now on for your amendment.
You have the language ready? Yeah.
we got to add amendment
And
of minority.
so there's one amendment that's cooking. Let's see how we're doing with that.
Pass the bill, and then you amend it, and then
You amend it before you pass it. Yeah. So that you're passing an amendment.
You have to have a do pass motion first.
And now, this is the time for amendments. Yeah.
Right.
This is the
This
time
is the
for-
time
But we haven't
for
voted
an
on the
amendment if
motion
there's
to do
going to be
pass.
an
We just
amendment.
made the
So
make the motion do pass, then you amend it, and then
do you guys have language? Do you, okay. Ms. Crittenden, would you mind?
As amended. Uh-huh.
Correct.
Hold on, ladies, the ladies got it.
We're good. Yeah, we're good. Go ahead.
At line 30, after legislators, comma, including one member of a minority party,
And then semicolon.
and the semicolon, everything else stays the
Down
same.
line 32, you do the same thing.
And on line 32, after legislators, comma, including one member of a minority party.
That's your motion, right?
That's, yes.
Now,
They're-
now, Madam Chair,
She's doing something.
We okay? We okay?
Yeah, let me just ask you one quick question.
What this means is you have one non-legislative.
Yeah, at least 2 of the 3 members shall be legislators. They could all 3 if they chose to, but it's,
I completely agree with your amendment to have a minority member. My question is, if we have a minority member and then one of the members doesn't have to be in the majority party, would we want to replace the potential non-senator
the non-member.
to guarantee that way you've got 2 majority members?
well, it's direction at the lieutenant governor and the speaker to make those appointments. If you want to get that part, should we put, you had to appoint a mayor? We talking about implement that?
I'm not saying that. I'll let you make that move.
I just want to know. We help make them now.
Sorry, I didn't turn your mic on. We think we might have a slightly better way to word that, if you can talk to Ms. Crittenden for a second. Number 2?
Yeah, that's all. Yeah.
Yep. I mean, Madam Chairman, the governor's appointments contemplate non-legislators. I just wanted to know, I wanted the lady to think through what the possible outcome can be of how many non-legislators are on this. I know she wanted to have policymakers there. My preference in these, I mean, I completely agree with the member of the minority party, both. I just think the more we get away from legislators and the more it's non-legislators, I don't know why. That's, to me, the lieutenant governor and the speaker ought to be appointing only legislators, and then to include one of the minority party, and then let the governor appoint the non-legislators. That way we have that strong 6 members are legislators. It doesn't mean that the lieutenant governor would not. I just think it's the presence of the ability to appoint a non-legislator implies that he probably, he or she should. I just think speaker, lieutenant governor, legislators, governor, non-legislators. It just made more sense to me.
It's a neat approach. I mean, it's a very understandable approach.
Yeah, it's just, so in doing it, I guess my question was, do we as a body want to have, just simplify it, 3 senators, 3 reps, 1 of each has to be from the minority party, and let the governor be in the non-legislator appointment business? That's all. I was just thinking out loud. Because this contemplates the LG appointing a non-legislator, which I think
It's a stretch.
stretches this to being less legislative centric. That was it. Just for the author,
I'm
really.
okay with that.
Representative Daniel, you're good with that?
I'm okay with that. That was something that we kind of played around with, trying to figure out what, and I was okay either way.
Okay,
are you
so
saying strike?
that's a different type of amendment than what we were discussing.
So we can have 2 amendments, so, but all we have to do is strike at least
3 membership.
3
Yeah,
members.
provided that,
Wait a minute, all right. I'm
or
almost
3
done.
3 legislator members shall be appointed by the
Yeah.
lieutenant governor,
Okay.
include, and then that phrase
Minority
that you
party
read,
piece,
Sarah.
and just strike that existing
Yeah.
clause. Yeah.
I think I've got, how about,
Ms. Crittenden, we'll get you to read that back to us before we propose it.
And Madam Chair, I'm just throwing that at the author to make sure we're staying in the bounds of what
Yeah,
she wants. I just,
We're good.
she's good.
Thank you.
Yeah, all right. So like the captain will appoint the chairman, other. Like being on the cruise.
That works.
you going to read that to us? Okay.
Yes, that's simple.
Okay.
To the author, the way the bill is written right now, it says 3 members shall be appointed by the lieutenant governor, provided that at least 2 of the 3 members shall be legislators.
It's going to be 3, though.
Well, I'm bringing up a different point right now. So the legislator part, should it be senators are appointed by the lieutenant governor and representatives are appointed by the speaker? Or do you want to open it up to where the lieutenant governor could appoint a representative and vice versa?
Oh, no.
I think that
I mean, if we're amending, let's get it right.
standard commissions that are already in place, and so I don't
Don't mix up the House
know.
politics with the Senate politics, though.
I don't
Well,
know.
it says legislator.
That was not
It
intent.
doesn't specifically say
We can,
senator.
I can draft, we
You
can
talk
draft
about
it.
who's
We can
appointed.
draft that.
She can.
I can do that.
Yeah, so she can give specificity to it, so that there's no confusion, so that the lieutenant governor doesn't start appointing House members.
Just don't make it that
Heaven
difficult.
forbid. The House member is the author.
We can make them all senators.
We would come back, except this is our last meeting, so we need to do it now.
Told you I'd be quick, and it would be easy.
Nothing's easy around here.
It's all the time. I sit next to him. It's all the time.
Okay, I think I've got it.
Okay, your
wanna
mic
hear
is
it?
on.
Okay, at line 29. 3 members of the Senate shall be appointed by the lieutenant governor, provided that at least 1 member shall be of the minority party. Okay. And, oh, but not the same. 3 members of the House of Representatives shall be appointed by the Speaker of the House of Representatives, provided that 1 member shall be of the minority party.
That's good. Thank you.
Senator Orrock, you
Yes.
started this, so.
Yes, I would move that, that would be my motion, to
Okay.
amend with that language.
So you're proposing that we amend the bill as
As stated by the
Ms.
legislative
Crittenden
council. Mhm.
read? A second? Okay. Any further discussion? Okay. All in favor of the amendment? Raise your hand. Okay, that's unanimous. And any further discussion on the bill? Okay, so we've got a do pass motion and a second. So now all in favor of the bill as amended, which is LC 5205516S, raise your hand. Okay, so that'll be a committee sub. Thank you very much. So your bill passes
Thank you.
as amended. Oh, who's carrying it?
Senator
Robertson. Okay, got it. Thank you.
Who'd she say?
Robertson.
Oh, Robinson.
Okay, so next we have House Bill 1314. Representative Roman, come on up. Feel free to sit at the table if you prefer,
Thank you. Oh, or do you prefer over there? Okay, good.
whatever you want.
Thank you, Madam Chair, members of the committee. I am going off of LC 540371S. And so this bill is intended to make EMS as an essential service. The reason this bill came forward is I like to joke that my husband is a full-time lawyer, and to atone for his sins, he does EMT work part-time. And so he had introduced me to some of his colleagues who explained to me that in a lot of states, not just Georgia, at this point 36 other states, EMS is not considered an essential service. This bill intends to address that oversight, and we would join 14 other states, including Alabama, South Carolina, and Tennessee, in designating EMS as an essential service. The way the bill was crafted is incredibly narrow. It is not intended to change how we do EMS. You're good, you're good.
Hang on a second.
We just lost core.
You just lost one because we're out. We can keep going with it. We try to get something.
We can- We just lost our quorum, however,
I can wait.
he had to go to finance and present a bill, and he'll be right back. But
Okay.
hopefully,
wait.
it'll be no more than a few minutes. So why don't you go ahead with your presentation? We just
Sure.
can't take action on it yet.
Okay, I can wait. So the way the bill is written is intended to be incredibly narrow, so that all it does is only make EMS essential service. It will not change the way that we do emergency medical services in Georgia. And the other thing that I would like to note is one of the benefits of this bill is that it would reduce red tape that EMS providers currently go through, particularly during times of disaster when FEMA, for example, comes in and they are trying to coordinate. Fire departments get those grants, law enforcement gets those grants, but EMS is sometimes precluded from those, or they have to go through extra hoops in order to get that same kind of support.
He's not in there. Yeah. Okay, questions from the committee? We do have one person signed up to speak. So we'll go ahead and take testimony from Kristen Baker. You want to just go to the podium? Thank you.
Hi, good evening, Madam Chair and members of the committee. My name is Kristen Baker. I am the Public Affairs Manager and Lobbyist at Feminist Women's Health Center. We provide an array of reproductive health care, including abortion care. I understand that there are some concerns that this bill is some sort of backdoor way to allow people to get around Georgia's abortion ban. So I want to set the record straight so that this doesn't cause any issues for the bill. What I think this is referencing is that the debate that around the country that's happening around EMTALA and what happens in the emergency room. So EMTALA is the federal law that requires hospitals receiving Medicare to the funding, like Medicare funding, to provide the best emergency care possible to anyone. It gives the federal government some power to define what counts as emergency services, and there's currently an ongoing debate on the extent to which that can mean abortion care. This is the only really origin that I can imagine for concerns around this bill, because this bill has absolutely nothing to do with abortion. What happens in the emergency room and the resources available to the people who get you to the emergency room are completely two different things. So there's no way that this cutting of red tape can be exploited to force people to have do abortions in ambulances. I really don't know. This bill designates EMTs as an essential service and allows them to get more access to federal resources and grants, and allows them to do things like move faster and improve response time. So EMTs are not relevant in abortion law. This bill is not relevant to abortion law. It's a good bill, and it should be allowed to pass without a controversial amendment that might impact its chances in the Senate. Thank you.
So are we amending? Not doing that?
No, I don't think so. I haven't, any further discussion from the committee? Senator Setzler.
Yes, I appreciate the author's words. My goal would be to create a circumstance that does not create a, quote, controversial, unquote, amendment. I do think it's important. There's belt and suspenders language in B. This code section shall not be construed to revise, impact, otherwise. It goes on, shall not be construed to grant new or additional authority, oversight, or regulatory power. I think it could be, I think it'd be wise to add an amendment that says authorize, again, in a non-controversial language that does the job, any medical procedure, service, or medication prohibited under Title 16, 31, or 43. That doesn't point to any procedure, but it's been raised to me a concern that I like to behave in polite company, and this is not something I'm looking to create any controversy over. But I think we've got to be mindful that when we've got circumstances in which there's an administration that's allowing unlawful Mephoprex to be sent through the mail to people, and they're looking the other way, and it's happening in our state. We know it is. I just think we have to, without in any way harming the bill, we have to have the conversation to make sure we're not by creating this, allowing a backdoor for things we don't realize we're doing. And I think if we're sober and careful about it, I think it's a fair conversation to have. So, and by the way, legislative here, and the author was a tremendous professional coming to me and raising this. She did it with great care and attention. I just think it's, when you talk about emergency medical services, declared to be essential services, are we creating a circumstance where we're doing something we don't realize we're doing? Simply by a federal rule or interpretive guidance saying that it's sort of now allowed. If it's not the intention of this body to do it, I don't see what's a problem to prohibit it. And I don't think it's going to harm the passage of the bill. And again, I think to the author's concern, I think using certain words kind of can create a lightning rod. But to say that it does not authorize any procedure, service, or medication prohibited under Title 16, 31, or 43, that's not controversial language. It's just saying can't be construed to authorize something that's otherwise not authorized.
So, is it okay if I respond to that? So I completely understand the concern, and I like to joke. The joke I made earlier is that even though English is my second language, it does say emergency medical services, not emergency medical technicians. So the acronym EMTALA is EMT-ALA. When I sat down with Legislative Counsel on this, we actually originally pulled language from other states into this bill, and it became clear that it would be too broad, it would have too many unintended consequences. So we went back and we actually rewrote the language to be specific to Georgia in this specific code section so that it does not touch on anything else related to emergency rooms, related to anything else. Truly all this bill does, and the reason we were so intentional about keeping this so narrow is people joke that I love to talk about unintended consequences when it comes to bills on the House floor. And so when I went to Legislative Counsel, I explicitly had asked them, how do we make sure this is narrowed? I'll be honest with you, I was very blindsided, and I really wish those who had thought that had come and spoken to me, because I would have explained to them that these acronyms are actually completely different acronyms. They have nothing to do with each other. And the only other thing I will say is I would really hate for this simple bill that our EMS providers have been honestly waiting for a long time and never expected to get this far, to be pulled into something that they frankly have nothing to do with. And it would be great to do something good for them. So,
if you eliminate the first four words, that they can take out any question. So just start with the ambulance services.
Yeah, well, that was going to be one of my questions. Emergency medical services including, if it's just ambulance services, then we can just say ambulance services. When you expand it to emergency medical services outside of that, it's a much broader play. Now, I presume there's something in the universe of emergency medical services broader than ambulance services that is intended in this.
No.
And again, with the deepest respect for the lady, it really isn't what we intend. What we intend, what we say in committee means nothing. It's the black letter law we put here. So I just want to make sure this doesn't come from a misunderstanding from House members. This doesn't come from you being ambushed. This is committee where we talk about these things. Now's the time to put these things in place. And I'm friendly to putting language in place that doesn't create a lightning rod. If we don't address these things now, these things get addressed on the floor, and it does become an issue.
We got it. Thank you. We appreciate that. Let me recognize my vice chair again. Is it 4? Okay.
Yeah, I was just going to suggest that perhaps we eliminate am I looking at the right thing? I'm looking at the wrong.
It'd be the first 4 words.
Eliminate the
line
first
10.
4 words on line 10 and just start with ambulance services.
Okay.
Would that be suitable to you?
Senator Setzler,
Would that solve it for you?
I think that takes the ambiguity out of it, because emergency medical services, including, we would start off with ambulance service.
I don't have some theory that ambulance services are going to be doing this.
Right.
It really is that emergency medical services, the breadth of it.
Right. So if we take the first 4 words out of that, is that, Okay. Senator Lucas, you're on number 12.
Mr. Chairman, I got a problem with it. Ambulance services are for emergencies. We don't know what might happen. Somebody get injured, and they might be pregnant. Or they go to hemorrhaging. Or their water breaks. And what ambulances do, and their folks and technicians are trained to try to handle any of these situations. So I understand what you're talking about, the law we have, but we ought not to curtail the folks who are in the business and doing the business to see about folks in emergency situations. We ought not to make them criminals.
Completely agree.
The only other note that I just got is that there are parts in the state that are too far away from a hospital to have ambulatory services, so they rely on flight EMS. Would that mess with
No,
that?
this is still our air ambulance.
Okay.
Mr. Chairman,
Yeah.
may I say this? Counties are now hiring folks to do EMS service when they don't have a medical clinic or something. They carry their folks to different counties.
I appreciate that. So let me first of all apologize for not being here on time. I was pulled away. Okay. So I'll be happy to entertain a motion for due pass. Move due pass. Senator Setzler, Senator Halpern is second. Now we're under discussion. Any further discussion or amendment or change in words? Okay. Senator Setzler, would you like to do that? You're on mic 2.
Mr. Chairman, I don't want to create an unintended consequence. If there's an emergency medical service that's broader than ambulance, then there's a way to address this. If ambulance services is what we mean, and we're not cutting things out that we don't want to cut out, I think striking the first 4 words on line 10, so that we'd ambulance service where they're provided by public-private, if that meets the intent, I think we're fine.
So do you want to propose that then?
I just wanted to know I'm just asking the author, is there something broader than ambulance we mean here? Because if there is, there's different approaches to it.
Yeah, I don't think so. Again, it's complicated in Georgia the way we provide ambulance services, but I don't think so.
Okay.
Thank you.
Mr. Chairman, I would propose then to strike emergency medical services, comma, including, and capitalize ambulance is the
And
amendment.
make it services
Yes,
with an S.
and services with an S.
Okay, and you want to strike that language and have a second on that? Second on that. Okay, any further discussion on that?
I object.
Okay, we're going, duly noted. Leader?
So if we strike emergency medical services and a person is in a vehicle on the way to a facility, what are you supposed to do if that person is really having an emergency?
This really is just, the bill is about whether or not this is essential services in the state. That's what the bill is about.
I understand that, but if they're
All right, any further discussion?
Yeah.
All right, Senator Lucas.
Chair.
Yes, sir.
I disagree with it. We have emergencies, and I understand what you're trying to do is use abortion when we don't know what happens in a particular situation. And what emergency vehicles do, who have trained EMTs, they handle the emergency. So we're putting something in here that's going to make a criminal out of somebody in case somebody goes into labor.
Yeah, Senator Lucas, I think we're not putting that language in there. We're striking out those words.
When you
just as
take
ambulance service.
emergency out, you are. Because that would be an
Okay,
emergency.
you can, duly noted. Anything else? Any further discussion? Yeah, I get it. So we're in the posture. Any further discussion? I hate to, we have a couple of folks who've walked in. Let me just update you and give you the posture that we're in. So we have, we've moved due pass on House Bill 1314, that's LC 540371S, and we have an amendment on the floor, which is really striking on line 10, emergency medical services including. We're striking those words. We're changing ambulance with a capital A. It will be ambulance services with an S, then whether provided by, the rest is the same. And the logic, Senator Setzler, was the concern is that emergency medical services includes things other than just in outpatient ambulance service. So his concern was that to be declared as essential services in this state, his concern was relating to elective abortion. And so this was something that was done in compromise, and that's the posture that we are in. And
Ain't no compromise.
Mr. Chairman, three of us
I'm
just,
recognized Senator Orr.
I'm just going to say, that three of us just returned, so maybe we need a little catch-up.
Okay.
We walked in the middle of,
So, and that's what I was trying to do. House Bill 1314 is trying to recognize ambulance service in this particular situation as essential service in this state, whether public, private, nonprofit, or private for-profit. That's it. That's what this does. All right.
And to the lady's question, if this bill is not intended and calculated to somehow legalize what would otherwise be unlawful abortions, then there shouldn't be a problem putting that in, saying that it's not going to do that. Alternately, the vice chair raised the question, shouldn't it be, since this emergency medical services definition is very broad and somewhat undefined, if we're really talking about ambulances, let's just sidestep essentially Senator Setzler's concern by defining as ambulance services. There is no concern, and we define ambulance services as essential. And if that's the intention, then it just avoids any concern or ambiguity.
And the author is?
Yeah, I mean, the only thing I will say, because I'm trying to think about it through my head as we go through this, is in Georgia, the people who provide EMS services are nonprofit, private, and for-profit entities. So as long as it doesn't mess with that, and as long as it encompasses EMTs and paramedics, I'm fine with it.
Okay. Thoughts? Any Senator Lucas? I'm recognized Senator Lucas.
Mr. Chairman, that's what ambulances do, emergency service. They even have a board and thing and decide what territories they're going to cover. Are you telling me that if a lady has a problem delivering a child and you call an ambulance, either the water is broke, she's hemorrhaging, she's having pain, that you gonna let her die? Well, that's what you're doing if you take emergency out of it. They're trained to handle emergency situation and get a physician in the trauma room and call them and ask them what to do.
Senator Lucas, you've expressed that opinion. I think everybody on the panel here strongly disagrees with that.
I don't think everybody disagree. We'll find out when we vote.
Let me.
If you were right in the facts, I would agree with you. If that's what we were saying, I would completely agree with you, Senator Lucas. We can't make that a problem. But what we're doing now doesn't do that. It just makes ambulance services essential.
All right, so any further discussion? All those in favor of the changes that we've outlined, I'm going to do it one more time. House Bill 1314, LC 540371S, and the amendment is striking the language on line 10, emergency medical services, including, and changing the ambulance to a capital A, that word, and making it services with an S. And that is the only change. And all those in favor, raise your right hand. 3, 4, 5, 6, 7. That's 7. That's 8.
And I'm opposed.
8. 8. And all those opposed? Opposed. Gotcha.
Just thinking through this amendment.
Okay. Okay. Let me get you line 5, Mike 5.
My understanding, and just question to the author, is the inspiration behind this bill, the policy behind this bill is to ensure that paramedics and EMTs during, I guess, states of emergencies or something like that, get paid or get funding for being essential service.
There's a
services, right?
few reasons behind this and the consequences of it. Number one, we define law enforcement and fire as essential, but we don't for EMTs and paramedics, which is an oversight in my opinion. 2, yes, there are some grants that you have to be considered an essential service to qualify for, and so they have to go through a bunch of other hoops. They have to go through their fire departments. They have to go through a bunch of other avenues, for lack of a better word, unlike other services being provided, like law enforcement and fire. So that was the impetus for this bill. There is no other reason behind it. There's no other anything behind it, to be quite honest. That's how it came about. Was I learned about it, and it was surprising. And they kind of looked at me one day and said, "You're a state representative. You can do something about it." And I said, "Okay, let's try to do something about it."
All righty.
So
Any further discussion?
Discussion on adding something to this would be, off the amendment we just did, ambulance services provided by paramedics or EMTs.
Or you could also add an emergency ambulance service. That's also, I think, reasonable from that perspective.
Because I don't know how broad, or if just ambulance services is even defined.
Or emergency ambulance. I know we're thinking, that may be emergency ambulance services.
Yeah. But adding the paramedics and EMTs.
Is the paramedics and EMTs needed? I mean, I thought we were recognizing otherwise.
I would assume it's included, but I'm not opposed to adding them in here.
I don't have any concerns about ambulances. I mean, they may do me on this, but I don't have concerns about ambulances. Emergency ambulance, I would defer to the chair. I mean, some of it is styling in Title 31. We want to be consistent and live within Title 31 as we need to.
Yep.
But while we're talking, I mean, emergency medical services could be indefinitely broad. That was just.
Sure, Mr. Mackey, you want to approach the podium?
Josh Mackey with the Georgia EMS Association. So 2 things. I don't think adding EMTs and paramedics specifically is necessary, because in times of mass casualties, when somebody would be declared an essential service, it would be the actual service, not the individual. In addition, ambulance service is very broadly defined in Title 31 for emergency situations. It is inclusive of air, so it is the appropriate term to use.
Okay. Thank you, Mr. Mackey.
Ambulance services,
That is a defined term.
Yep.
That is the
That's the code
typical
that's
thing we
Title
use
we're
in
in.
Title 31, ambulance service.
All right.
Yeah, that's the title we're in.
Ambulance services, yes. We're clear on that, yeah.
Quick question for Mr. Mackey, Mr. Chairman.
Yes.
Does this change mess up anything your association is seeking to achieve through this?
I don't think so. I think it would be fine.
Because we're trying to accomplish our goals.
Yeah.
I just want to make sure there's no, in the spirit of
Yeah.
unintended consequences.
I think it'll work. I think it'll accomplish the goal.
Okay. Thank you, Mr. Mackey. Appreciate any other questions for Mr. Mackey? Any further discussion? Okay.
Nope.
All righty, so all those in favor of House Bill 1314, LC 540371S, as amended
By committee substitute.
by committee substitute. Okay. By committee sub, all right. LC 540371S is actually House Bill 1314 by committee substitute. Is where we are. Gotcha. Any questions, any further questions? All those in favor, raise your hand. Oops. Okay, and that's unanimous. Thank you. Appreciate y'all returning.
Thank you. That was my first bill. And I'm fasting, so I'm so sorry. I'm like a little out of it, but thank you so much. Thank you so much.
We still have a quorum, and if we, President Mathia, we really appreciate you being here, hanging in with us. We're at House Bill 1363. We do have a committee substitute. And have you had a chance to look at that?
Yes, sir.
Okay.
What I'm working off of this evening is LC 540373S.
Okay, hang on, let's make sure we all got the right one, okay?
Uh-oh. It is the correct one?
The correct one is LC 520559S. All right, so let me just update everyone here on this. What we did was we took out the triggering mechanism, i.e. we continued with the study, but the actuality of the, depending on what the study shows, it will be reported back and will not automatically be implemented. And that was at the request of multiple different, including multiple different sources, including departments and higher ups, and I'll leave that at that. So if there is a difference, then it will be reported back, and then that will be acted upon. So that's, if you want to explain the underlying bill and your thoughts on that without the triggering mechanism, if you understand that or if you have questions, be happy to entertain that.
Thank you, Mr. Chair. I appreciate that. Okay. Let me try to explain where I was headed with this bill. Is that appropriate? Sure. Okay. What we are trying to accomplish is protection of smaller pharmacies, the quote-unquote mom-and-pop pharmacies, the local pharmacies is who I was trying to protect. It's our opinion and our statistics that we've gathered up from the difference of a large pharmacy and then how they're being reimbursed and how a small pharmacy is being reimbursed. There's two different reimbursement fees, and that's what we were trying to look at to, quite frankly, salvage our small. Oh, do we still have a quorum? Okay, thank you, sir. So that's where I was headed with this, was to protect those small
yes,
pharmacies.
And I'm in 100% agreement with you. Independent mom and pop pharmacies need to be on a level playing field with the large groups, and I'm 100% there. And I'm aware of some of the drugs that have been listed showed great disparity. But I'm also aware that that's my section of the budget in health. Okay. And I'm aware of the total numbers that go to each, and what's reported to me is that in actuality, the numbers that the mom and pops receive, if you look at the totality of the budget, then they actually receive at least as much, if not maybe a little bit more. So there's a little discrepancy, and that's why I think we ought to study this, and we should not link it to an automatic, let someone else decide if we're going to increase it. And that was my thoughts, and not just my thoughts, but others.
I think we're on the same page, sir.
Right,
I think
okay.
we're very much
So
on-
I think
in
that
agreement.
will be reported back to us, and again, I'm a big fan, and from that perspective, and so that's the posture. And I will let you decide if you want others to testify, but we have a quorum of 7, and it is late, and if you, so I'll leave that up to you from that perspective.
Personally, I would like to hear from others.
Okay.
I'm glad that we left the actuary in, because I think that you're absolutely right. That's going to be the meat and potatoes of what we're trying to accomplish.
Okay. Would you answer a question?
The question of the chair, is the chair in a position to take a motion at this point?
I am, but if Representative Mathiak wants to have others, I mean, the concern, I've already expressed my concern about a quorum.
Okay. One shouldn't talk past the close, but I don't know where her votes are.
Okay. Sure.
Representative, I've gotten a lot of calls on this bill. A lot of people in my community care about this bill. It's important to them. The substitute that you see, do you think this is a bill that they want? They want us to pass it like this, or is it good language? Will this help them?
I think it will help them, but I think that it's limiting. I think that whatever we can do to get the correct numbers. I'd like to see an actuary that isn't being put together by the big box stores, something that we can actually really get good numbers from, is what I'd like to see in the actuary.
Okay.
Does that make sense to you, I hope?
I think so. I think I'm
Okay.
following what you're saying.
Because I think that's part of the problem, is I'm seeing numbers from the big box stores and I'm seeing numbers from the mom and pops, and I'd really like to see what the state health benefit plan is really paying out.
And that's the
what
portion
I
that we
think-
did not change any portion
Right,
of that.
and I think that's where we're on the same page.
That's what they
Mr.
want.
Chair. I think that's where we're headed.
You're number 9.
I'm, like the senator, I have received lots and lots and lots of calls from independent pharmacists who don't think they're getting a fair deal.
Exactly.
And I have not had a chance to read the sub, and I don't know that I want. If your sub basically studies this problem a little bit more to give more definition to it, is that what it's doing?
Yes.
That's accurate.
And if you're bringing the bill, and if you think that your original bill, that this will be as good as your original bill.
No,
then
I mean, let me just let me be
Please,
clear on
because-
that. The trigger, the only thing I took out, the study is exactly as hers. The only thing I took out was that if you look back, the bill from before is that there was an automatic trigger to align itself with an agency not related to the state to take it to those levels and continue to increase it with time. That was removed. Doesn't mean we can't do it in the future. We certainly can, but it will come back here first before it will be done. Uh, 10.
So I've been overwhelmed with the calls, and I just want to be clear, the numbers that you're looking at that you say, who's giving us those numbers? Are those numbers coming from CVS, or are those numbers coming from the small independent pharmacies? Because I just don't trust that we're getting the accurate information from the big guys.
Yes, not the big guys at all. So I've not discussed that relating to that.
Mr. Chairman.
Yeah, I'll tell you what I'm going to do. I'm going to take a 2 or 3 minute recess, and we're going to go offline, and then I'll come back on. Are we back online? Okay, thank you. You know, unfortunately, late hour, our session went late today, and we have other meetings that are meeting, and we have lost a quorum. But there are other options out there that I think that we can help you with, and I, like you, want to help small business, independent pharmacy, 100%. There are other options, either doing it on the floor as an amendment or doing it in an appropriations bill in conference and adding in language for a study. And I think that would not be unreasonable. As a matter of fact, that may be the best way to do it, is to put language in the budget to allow a study, and then it will be done. Because I think the study needs to be done. I think we need clarity on this, and I think that would be helpful.
Will we still be able to attain that study by December?
The department would do it actuarially and appropriately from that standpoint. That's, yes.
December 1's in the budget language, will be December 1.
Okay.
Yeah.
And that's what we hit, okay.
That's what we'll work on, and we'll need your help from the House, and we'll get it done. We'll try to get it done from the Senate also.
Okay.
Okay, that will be in conference committee.
Okay.
Okay. Representative Mathai, thank you for bringing this, and meeting is adjourned.
Okay, thank you.